will know. You will be very happy, okay? Okay, so you can see that there's a pre-hole here, and it's going to be a little bit more difficult to get through the derms. Actually, it's not. It's actually very doable. So usually I just open the hole a little bit by stretching the skin so it's easier to enter the dermis. Then I get resistance. So I rotate to get through the resistance. Now I want to go with my cannula between the infraorbital foramen and the infraorbital rim. I'm not going to go into the tear trough. I'm just going to go to the periosteum. So I go through the SMUS. I'm through the SMUS now. I want the opening to be facing the periosteum. So I advance by lifting up the cheek. I'm sliding over the periosteum cannula until I feel it, you know, touching my finger, and I know that now I am just next to the foramen. So I should stop advancing. I place a little bit more product. Okay, that's it.
Okay.
Oh yes, holding the breath again. Yes. No, it's scary. I mean, this is very close to the infraorbital nerve, you know. It's very close to the eyes, you know. Patients get very nervous in this area. I actually injected myself in this area, and that was the scariest thing I've done in my life. I started on the right side, and then I had to go to the left side. In the mirror, with my left hand, I will never do it again. Do you feel that there's a little bit of anesthesia now working? You feel a little bit of numbness? Yeah? Okay. Now I will not go so deep, I will go more superficial, okay? Okay. Just keep on breathing. Don't hold your breath. So I stretch one finger behind, one finger in front of the cheek. I advance the cannula by rotation. I put the bevel up, and I start injecting 0.05. Change direction. 0.05. Okay. Just a little bit more here. Just a little bit. Just I want to make sure that you are really happy after the treatment.
Yes. She thanks you.
You will thank me later. Okay. So, you can understand that a cannula might look amazing to us doctors. And actually, if you think about it, a cannula is such an elegant medical instrument compared to a needle, because this respects the anatomy. And of course, you know, a needle is very precise and it's very fast, but it also can damage blood vessels, nerves, etc. And you know, the reason that I'm actually kind of wiggling by rotation, wiggling the cannula, it means that if there's a blood vessel on its path, it will just push the blood vessel away so it can pass the blood vessel without damaging it. Okay. So, I will give her a little blab of anesthesia in the nose tip. Oh wait, it's still in my hands. Yeah. Okay. Okay, so what do you think? Do you think she's going to be fine with the cannula in her nose? Very good. Very good. Very good. Okay, so the trick is to stay in the midline. I get the opening of the cannula to face the skin. You okay?
Yes.
What's your name? What's your name? Do you like palm trees?
Yes.
Yes? Okay. Let's just inject 0.05. 0.05 to 0.1. Am I in the way? Are you okay? Good. You look okay. And I keep on massaging from the lateral side. I make sure that the product stays in the midline. Okay. And now she's holding her breath again. I have to stop. Oh yes, that's right. Breathing, oxygen coming in. Yes. Okay. So, and then it's a matter of molding a little bit, massaging a little bit. Okay. Thank you. You're doing so much better. Yes, because the nose is really a difficult, painful place. Could you attach a cannula to that one, to the new syringe? We do the other side, and the other side is known territory for you now, so you don't have to be nervous. Okay, so we're going to focus on the left cheek. Going to make a pre-hole. And another one. So I'm scraping the dermis with the tip of the needle. Thank you. So she is a very good nurse because she gives me exactly what I want. I go into the skin. I open the skin by stretching. I rotate to get through the dermis. Then I have to go through the smooth. So I lift up the smooth. I rotate to get through the resistance. Now I'm through. I'm at the pre-periosteal fat. I advance the cannula over the zygoma. It's parallel to the alotragal line. So I have to check the location of the cannula tip. It's over here. I give a bolus of 0.1 with the bevel towards the periosteum. 1 centimeter back, so I look at the markings. I give a bolus of 0.1. 1 centimeter back, 0.1. 1 centimeter back, over here, 0.1. 1 centimeter back, 0.05. Okay. I advance it all the way to the infralateral side of the orbital rim, underneath the SMAS, underneath the deep fat. You know, I'm just sliding over the periosteum. You know, it gives a little bit of deep pressure to the patient, you know. Also, I give some deep volume over here. And the last 0.1 to 0.5, 0.1 to 0.15, inject superficially. Okay. Okay. Just a little bit extra here at Swift's point. Okay, great. That's it. Oh, it reminds me. It reminds me of labor. You're breathing like the baby is coming. But that's also worth it. You okay? You want to finish today, or you want to finish next week?
No, today.
Today?
And now.
Or next time, because next time will be November.
No,
No?
I'm ready
Okay.
for everything.
Okay. Just to keep you motivated. I usually, when a patient is feeling a little bit dizzy or getting vasovagal, you can tell her, you are here because you want to be here. And sometimes it helps to give a mirror so she can look at what the what the pain is gaining. So I open up the skin. You can zoom in. I open up the pre-hole by stretching the skin. I introduce the cannula. I rotate to get through this opening, and that's how you can use a 25 gauge needle with a 25 gauge cannula. Then I go through the SMAS and in the direction between the rim and the foramen. Now she thinks this is dangerous, but now she doesn't feel anything. She is okay. Are you okay?
Yes.
Yes? Do you have children?
Yes.
How many?
One.
One?
Yes. Boy.
Boy. What's his name?
Kamal. And I have.
How old is he?
Diablo?
Is 30.
30. Ah, is it-
And he has
Is he a doctor?
children. No.
Okay, it's out, it's out. So somebody took pictures of you, huh, before the treatment? Are you all right?
Yes.
Okay. Okay. So we're gonna go and put maybe you can because we used almost 2 syringes now. One more syringe. One more. Okay. So we're done with the cannulas in the scary areas. So we will clean her up for the cheeks, and then in the meantime, I want to have just one last little bit in the syringe in order to show you how dramatic the chin augmentation can be for a patient.
It's stronger than this one?
No, it's less strong.
Yes.
So basically, if we look at the ideal proportions of the chin, with the males, the chin can be as wide as the mouth. But with females, it should stay within the limits of the ala, if you look at the ideal proportions of the chin. And actually, a pointy chin is considered to be more aesthetic than a square chin, which is more aesthetic for males. So actually what we're going to do is we're going to accentuate the V shape of the face by introducing the needle in the midline. We're going to pull the mentalis muscle in order to create a little bit of space, and we're going to hydrodissect the muscle from the periosteum. So I will take the needle on the syringe, which is given to you if you buy Radius. It is actually a very nice one. It's a 28 gauge needle, so it's thinner than a 27 gauge. And it has a fine wall. And I'm sure that Softfill also wants me to talk about their needles, but I can't see them anywhere. So what I'll do is I'll go with the syringe, I will go straight down in the midline towards the periosteum. Okay, I go in and I give a little blab of Radius. This will anesthetize already. Another one, 0.05. I will go left and right, touching the periosteum, so it's safe. So it's all little boluses of 0.05. Are you okay?
Yes.
Good.
How many children he has?
One. She has one child, right? Was it a son?
Two.
Two children. She's a grand.
Oh, he has children also?
Yeah.
Ah. Yeah, 2 grandchildren. Okay. Maybe I created a small hematoma, small bruise. Of course, you know, we have to take into account that there are actually hardly any danger zones in this area. It's a very safe area to inject, especially if you place your needle on the periosteum. But of course, there is the submental artery. It's running all across this area. And of course, when you go up and down with the needle many times, it's possible that you can nick it in some place. So we can use a little pressure. You all right?
Yes.
Is it painful?
A little.
A little. It's more scary than painful, right?
Yeah.
It's very good. I paid her to say that. Okay, we do a little bit more. Can you see it? Because I can't see the screen. All right. So I use the Steiner's line, and we're not there completely. If you look at the side, okay, if you look from the side, you can see that if you take a straight line from the chin towards the tip of the nose, we're not completely there yet. Maybe you cannot see it like this. We are not completely there yet. We should accentuate a little bit more. And as you can see now, the mental crease and the marionette line become more pronounced. But I think after this, we have done 3 indications, and we have to move on. So, with the last bit of radius,
خلي كمان شوي بس ما حتوجعك مثل المرة الماضية. خفيف.
okay, I'm on the periosteum. I give a bolus of 0.05 to 0.1. Can you see it? Or is my hand in the way? Can you check it? All right, let's change needle because the periosteum and the bone make the needles blunt. So in order to make her happy, we're going to do a little bit, before we can send her home, we're going to do a little bit in the marionette line. So you can go even past the oral commissure a little bit in order to lift the corner of the mouth. So as I told you, the lip is really off limits. So we have to make sure that the needle does not go into the lip. A little bit of the pre-gel sulcus. But I think she doesn't want me to continue anymore. But you know what? She's going to be happy. Okay. All right. That's it. We're going to do the same on the other side, and then we're finished. Then we're finished, okay? You are a very brave lady. You're doing fantastic, okay?
Thank you.
Okay, almost done. So we're going to treat a little bit the marionette line. Breathe, breathe, breathe.
Yes, it's okay.
It's okay? Okay, can you see it still? Or is my hand in the way? Okay, I go a little bit past the oral commissure. Okay. Okay, almost done. Almost done. So the pre-gel sulcus. And breathe, breathe, breathe.
This one will make it deeper to also.
And I think we should let her run free again. Okay, the last one. Okay.